Healthcare workers from across the Isle of Man have been meeting here at the Burrell Suite in Douglas today to discuss about healthcare, especially in the elderly, and how in future more people will take more care of themselves. Norman, you yourself have got a long-term condition. Can you tell us about it and how you've been affected?
Yeah, I've had a long-term condition since I was 18. I've got a spinal condition called ankylosing spondylitis, and through the years, self-help is the real way to deal with that, because you've got to exercise and manage the condition, otherwise it manages you, basically.
And people coming here today, what are they learning?
I think we're looking at involving, it's teaching everyone what's out there really, and learning and teaching people about self-management, but also finding out what groups they've got that people can move from one group into another. So once they've had a course of any sort of treatment, whether it be at a GP's or they've had been on one of our courses at Live Well, Stay Well, or any sort of therapy, there's somewhere else to move them on into as a group that they can then continue as a helper themselves or as a group member in one of these specialised condition groups, and that will help them and encourage them and motivate them to manage their own conditions, and that in itself gives them higher self-esteem and also helps I think the government in less visits to the GPs, less medication and so on. Obviously financial benefits which everyone's looking at these days.
At the moment in the Isle of Man, about 1 in 3 people lives with a long-term condition, and what we know is that as the population lives longer, they're going to all be living with more long-term conditions. Health services are traditionally designed to support people who have acute illnesses, so a one-off episode of an illness which gets treated and cured. Well, there are no cure for many long-term conditions, and people need to find effective ways of managing their lives on a daily basis.